requiring more coverage for prosthetic devices. I'm Jill Horner. This is Comcast Newsmakers. With me is Pennsylvania State Representative Thomas Murt. Thanks for being with us.
Hi, Jill. Great to be here.
We're talking about a type of legislation that 6 states have already passed, and it's related to expanded coverage of prosthetic devices. What are individuals facing now when it comes to coverage and their insurance companies?
Jill, that's an excellent question. And many people lose a limb, an arm or a leg, and many individuals will get a prosthetic device, an artificial leg, we'll say, and the human body changes. We put on weight, we lose weight, sometimes the device wears out, and a good prosthetic device is a very expensive piece of equipment, of technology, and many insurance companies unfortunately will only pay for one prosthetic device during the lifetime of an insured. And as I mentioned, as the body changes, sometimes a prosthetic device doesn't fit so well. And they find out that the device is no longer functional on a particular individual, and the subsequent prosthetic device has to be paid for by the individual and not by the insurance company.
When it comes to this type of situation, were you hearing from constituents that their device had either gone past its life expectancy, it had worn out, or maybe a child had grown and needed a new device? Is this something that you were hearing? That's
exactly right, Jill. Many individuals, both in my district and across the Commonwealth of Pennsylvania, they are members of the Amputee Coalition of Pennsylvania, and they have brought these concerns to us, and they're very, very legitimate concerns. The technology that is used to make a prosthetic device is very sophisticated. It's very expensive, and you know, we see people with prosthetic devices running marathons and completing them. And you know, the prosthetic devices are very durable, and you know, technology is so advanced that you know, you can live a very highly mobile and functional life with a prosthetic device. But they do wear out, and again, the human body does change. We put on weight, we lose weight, and sometimes a device doesn't fit so good when you're 40 as it did when you were 20.
And what would your legislation do in terms of the requirement for potentially additional devices in a lifetime?
We actually, the legislation is written so it helps the insured, the person who has lost a prosthetic device. It tempers the 50% copay on subsequent prosthetic devices. It also does not allow insurance companies to just beg off subsequent prosthetic devices after someone's trauma. And you know, we know that a prosthetic device that doesn't fit so well, if the individual ceases using it and does not have an active lifestyle, there can be other types of problems that evolve, such as cardiovascular disease, obesity-related problems, and also subsequent amputations.
And I want to quickly ask, because this is something that could impact many people, are you getting pushback from the insurance companies because of the cost associated with this?
I would say yes on that, Jill. We are getting some pushback. We don't believe that the pushback is insurmountable. We believe that we can work with the insurance companies to reach a consensus on that.
And very few seconds left, but we want to quickly switch gears and talk about your epilepsy awareness outreach meeting. This is May 1st, related to another health-related issue, but you are encouraging people to come to the Upper Moreland Township building, 7 p.m. on May 1st, to learn more about epilepsy.
That's correct, Jill. I'll be working with Representative Madeline Dean to host this program.
Thanks so much for being with us.
Thanks, Jill.
We've been talking with Pennsylvania State Representative Thomas Murt. I'm Jill Horner.